Hello everyone, this is Lucinda Nord with Indiana Association of United Ways. On behalf of Indiana Association of United Ways and the Indiana Nonprofit Resource Network, we welcome you to this last day of November webinar for how Indiana nonprofits can adapt to post-election changes with strength. So in case you've just joined, we know we have a full house that's registered for this webinar. Hopefully you'll be able to hear through the speakers on your computer. If not, there is a way to dial in. The materials have been posted at the top of inrn.org if you would like to download the materials in order to take notes during the webinar. We will be sending out materials and show you web links for additional materials at the conclusion of the webinar and later today. So without further ado, we shall begin. I just call your attention to a couple things. One is in the webinar feature there is a chat box, and that's where we would encourage you to ask questions, especially for those of you who are listening through your speakers. So without further ado, let's begin. During this webinar, we plan to cover a number of topics, including, if I could bring it up, I apologize. There we go. Sorry. What we will cover today, we'll talk a little bit about the fiscal cliff because there's all kinds of conversations about the fiscal cliff right now and what it might mean for nonprofits. We will talk a little bit about the national and state election results and what might happen next. We'll spend a little time talking about what is on the horizon in the Indiana General Assembly and how nonprofits may stay informed and influence policy. So let's begin. What is the fiscal cliff? The fiscal cliff, or as some are now calling it, the fiscal curb or the fiscal slope or the fiscal bump in the road, is really the convergence of several things happening at the same time at the end of this year and the early part of next year. And the first is, of course, the expiration of the Bush-era tax cuts, as well as some other provisions that are all tax provisions that are supposed to happen at the year end unless Congress does something. The second is the sunset of a number of the tax provisions that were implemented during the economic crisis as a part of the stimulus package, and that includes the sunset of the 2 percentage point reduction in your Social Security payroll tax. So everyone will see those changes at the end of the year starting in the new year on their paychecks. The big conversation for nonprofits really is around sequestration, which is also known as automatic cuts to both defense and non-defense discretionary spending, in addition to the number of other spending cuts that were implemented previously. Then the final piece of this fiscal cliff involves the fact that we're reaching, as a country, the debt ceiling in the early part of 2013. It's anticipated to occur around the time that the continuing resolution that is currently funding the federal government will expire. Right now, that CR, continuing resolution that's funding federal services, will expire in March, and it's anticipated that the debt ceiling conversation is really going to rise around that time. So let's talk a little bit about the fiscal cliff. I've shamelessly stolen from some slides from the Center for Budget and Policy, the Center on Budget and Policy Priorities, which is a think tank in Washington, D.C. So let's talk a little bit about sort of our national conversation right now, and that it's all around the national debt. Generally, there's widespread agreement on the fact that the debt is simply unsustainable, that the mismatch between the revenues and the spending that's currently occurring with the national government is simply unsustainable for the future. So I think everyone agrees, Republicans and Democrats and everybody in between agrees that something needs to be done about the debt. The real debate is about how that should be done, whether that involves simply spending cuts, simply tax increases, or what's commonly called a sort of balanced approach that combines both spending changes and revenue changes. So let me take you back on a little history lesson first, and that is to remind you how we got here to this issue of sequestration and the big conversation around fiscal cliff. And it goes back to the summer of 2011 when the budget crisis at that point, we didn't have a budget, and Congress nearly shut the national government down trying to wrestle with this question of how do we get a new budget and how do we get a debt deal. So the deal that they made back in 2011 was that they wanted to pressure Congress to come up with a better solution around this whole issue of spending and revenues. So what you see before you is a pie chart of the national spending. And what was agreed that fall was that if they couldn't come to agreement, that beginning in January of 2013, which is just weeks away, those two yellow slices of the pie, the defense and non-defense appropriations, would be cut equally beginning in January of 2013. So that is the debt deal, and that's part of what's coming. And everyone knows what's in defense, but let's talk a little bit about what's in non-defense appropriation, which doesn't include all of the blue on the right, which are considered entitlements. Those entitlements will continue because of the nature of entitlement. If you reach a certain age, you are eligible for Medicare and Social Security. If you have an income below a certain threshold and meet other certain criteria, you are eligible for Medicaid. And it's really irrespective of the number of people or how much the budget can afford, those are simply entitlement programs. The two yellow slices of the pie are the pieces that are subject to the discussion right now in Congress, although there is entitlement conversation as well. So let's talk about that non-defense appropriation slice of the pie. This is where nonprofit, especially human service providers, are very concerned in that the non-defense appropriations include a lot of important programs such as a low-income energy assistance program, or LIHEAP. A lot of the HUD programs and housing programs are funded through non-defense appropriations. WIC, the Women, Infants, and Children program, transportation programs, things like parks, national parks are funded through this. A lot of education funding, including special ed and other programs like that, are funded through non-defense appropriations, as are workforce development programs and a lot of other social service programs. So I'm going to flip away from this slide for just a moment so that I can show you what that might look like after I describe what that means. So we've talked about some of the cuts. Those cuts will also mean jobs in Indiana. There's a lot of discussion at the national level about the defense jobs that are going to be subject to be cut as a part of this sequestration process. But I don't know that folks really talk about the jobs in the non-defense area. And there was a study done this fall, by George Mason University, really focusing on the defense, but they studied all the job losses, and they predict for Indiana 23,942 jobs will be cut due to sequestration. And of those, 8,992 will be in non-defense jobs. So we'll include the source here, and we'll send that out as well. But what I'd like to do is flip to another slide that just shows you some of that analysis. So I'm going to flip over here, so I apologize for just a second. First, I'll show you that particular study that was just mentioned, and that's the jobs per state. So you can see the kinds of jobs that will be affected here in Indiana, and that's according to this analysis. Now what I'm going to flip to is another piece of research that was actually done as a part of a congressional study, and this just gives you, this was through hearings held last year to give you a sample of some of the cuts of what that sequester might mean. So here we're looking at programs within the Department of Health and Human Services, of what the federal fiscal year 2012 and then the federal fiscal year 2013, what those cuts could look like in terms of jobs. And you see all kinds of job cuts in education, in health and human services, and then in labor, where we see the Department of Workforce Development kinds of programs subject to those cuts. So I don't mean to tell you that as a the sky is falling kind of alarmist piece, but do want to share with you that it is concerning that you know, when we talk about the services that nonprofits provide to people in need and that support important programs in our communities, we're also talking about jobs of those people who work in those industries. So let's go back to our slides and talk about, so what's happening right now. There's a lot of conversation in Washington, D.C. and in the media about what's happening right now in what's called the lame duck session. Congress is back, and they are currently debating the how this will be done. There are mixed ideas about how whether or not a deal will be struck by the end of the year to avoid the sequestration. Certainly there are all kinds of estimates of what kind of economic impact it will have on the country, what kinds of jobs might be lost, what kind of interest rates changes it might affect. So Congress right now is debating on the how. What we know about our Indiana members of Congress is that many of them have said, you know, everything is on the table, that they really would, a lot of our members from Indiana, the Indiana delegation, really want to see some entitlement reform. They are open to all kinds of changes to deductions, including things like the mortgage interest deduction and the charitable deductions. There's a lot of conversation right now about the charitable deduction and other things that are considered loopholes in the tax code. So one line of thinking really suggests that the way to close this budget gap is to close, not to increase the tax rates, but to eliminate a lot of those deductions, credits, and loopholes, both for businesses and for individuals. Another approach, or another line of thinking, really looks at allowing those Bush-era tax cuts to expire, which would effectively raise tax rates. And whether they call it a revenue enhancement or a tax hike is, you know, subject to however they would like to spin this particular issue. But all of those things right now are on the table. As you know, from all of the ads that transpired during the election campaign, there's a great debate about those tax cuts expiration and should they be allowed to expire or preserved, and if they are preserved, for whom should they be preserved? Should they be preserved for everyone? Should they be preserved just for lower income or middle class Americans? Should they be, what is middle income? You know, is it up to $250,000 a year for a couple, or is it up to $1 million a year? Certainly there are some in Congress who are now more open to the idea of letting those Bush-era tax cuts expire, especially on the highest income earners. What we know about our congressional delegation, again, is that they have mixed views, but they certainly are interested in looking at the full range of options in this lame duck session. So we will see what will happen with that. What we what we can do right now is if you as a nonprofit are very concerned about preservation of effective human services or preservation of the charitable deduction, which is a very important fundraising tool for many nonprofits, there are ways that you can act right now, and that is that you can call your member of Congress, you can send an email, and we have a link there. There are additionally some sign-on letters. So what I would like to do right now is to show you how you could get involved if you would like to work to preserve the charitable deduction or to protect effective human services. You could, as a volunteer, as a constituent, or as an organization, reach out to your member of Congress and take action. So let me pull up a couple of those. I had mentioned that there's a sign-on letter, for example, for the charitable deduction, and I'm going to pull up the Independent Sector's website. So you can see on the Independent Sector website there is a sign-on letter that currently has, oh, I can't remember, it's something like pages and pages, but we don't have lots of Indiana organizations yet listed on that sign-on letter. They plan to send it next week, so you can actually see the letter and the list of signers. So there are 11 pages to this particular document. You can go through and see what other Indiana or other organizations, maybe you have a similar type of organization in another state that is signed on. So from a United Way perspective, we are supportive of this letter. We will be signing on ourselves. We've been very active in this conversation about the charitable deduction. Additionally, I'd like to show you that if you didn't want to join the sign-on letter, if you actually wanted to take a little bit more action, we have through the United Way website the option for you to actually call or email your member of Congress, your specific member of Congress for your district about the charitable deduction. So those are two ways that you could get involved right now about the charitable deduction. You can use the same mechanism if you'd like to go ahead and talk about the importance of human services. Perhaps your own organization might be affected by some of those cuts that are pending, or you're just very concerned about the people who will be served by those organizations that may feel those cuts. So let's switch gears just a little bit. I don't see any questions yet. So let's switch gears and talk a little bit about the national and state election results and what may happen next. So we had some big changes and also a lot of the same with this election that just occurred. So at the national level, of course, you know that President Obama was reelected. We now have 53 Democrats, 45 Republicans, and 2 independents in the Senate, and 233 Republicans, 200 Democrats, and 2 races that are still yet undecided in the House. For Indiana, our congressional delegation actually changed just a little bit. We now have 9 Republicans and 2 Democrats in the House, and 7 of those 9 House members are actually will be in their first or second terms. So we have lost a lot of our long-standing years with the defeat of Senator Lugar and others. In the Senate, we have, with Congressman Donnelly's election to the Senate, we'll now have 1 Republican and 1 Democrat in the Senate. And that's at the federal level. So at the state level, we actually had some big changes at the state level. Of course, you all know that Governor-elect Pence will begin his administration, and he's actively preparing that administration, making some appointments right now. Attorney General Zeller actually won with the most number of votes of any statewide office But the big surprise this year was the Superintendent of Public Instruction or Public Education, Glenda Ritz. She actually had more votes, believe it or not, with her quiet social media and word-of-mouth campaign. She had more votes than even Governor-elect Pence. So big surprise, and it will be very interesting to see what will happen with the Superintendent Ritz working with a governor-appointed Board of Education, and to see how that will play out. Then in the House, we have supermajorities in both the House and the Senate. There are now 69 Republicans, 31 Democrats in the House. And what a supermajority means is that in both cases, the Republicans could simply take action without the Democrats even being present. They wouldn't even need them for the quorum. So we won't see, or it won't have an impact to have something like a walkout like in prior years. What's most interesting about the changes that are occurring in the State House, perhaps, is that nearly half of the House will have 2 years or less or fewer experience. And we had a big change in a number of retirements of long-standing legislators. So for example, the House Ways and Means Committee, which is responsible for drafting the budget, lost both of its long-standing leaders, with Jeff Espick and Bill Crawford both retiring. So we have a completely different, not completely, excuse me, a different budget writing team for the House, excuse me. In the Senate, we have 37 Republicans and 13 Democrats. Sorry about that. So let's continue on and talk about, so what's on the horizon in the Indiana General Assembly? We play this little game, you know, most of us who work in public policy, trying to read the tea leaves of what might come. We all know that there are potential budget cuts due to the sequestration and the already scheduled budget cuts coming from the federal government. And what most people don't realize is how much state and local governments actually depend on those federal dollars. So what will that mean for communities? What it could mean, there's a question of, will we see some increased regionalization? You know, those of you who are coming from rural counties might see that, you know, the services might be housed just a little bit further away from you with some types of services. But on the flip side, we also see that there might be some opportunities for some new partnerships. You know, nothing creates innovation and creativity other than need, and with some pending budget cuts, we might have additional needs to see that. Of course, there's an increased focus both from the philanthropic side and the government side about outcomes and measurements, and certainly government dollars are really starting to push toward outcomes and measurements. We know from the election campaign that there's this increasing debate, this philosophical debate about what is the role of government and what is the role of government in human services. And I think we will see that continue to be debated in the State House. Part of that conversation is a conversation about who is deserving of those services and assistance. And that's where nonprofit human service providers really can speak up to tell the stories, because there's so much misinformation about what services are provided, how much those services provide, and what are the true needs of the families that we're working with. And I don't have to tell anybody, if you saw any advertising this election season, about the highly partisan and politically charged environment, but what we're hearing, and we are cautiously hopeful, that we're really seeing some new signs of bipartisanship. Even though we will have this supermajority in the House and in the Senate in Indiana's State House, there are sincere communications about new ways of bipartisan work together. So we are very hopeful that this session will bring a new opportunity for those kinds of conversations. So let's talk a little bit more about what will happen, what we might see in the State House. So over on the right here, you see what we think are, at least for human service, nonprofit human service providers, some of the areas where we will see a top focus in this next legislative session. The first is a real focus on jobs. So many of our legislators, and certainly our governor, the Governor-elect Pence, ran on improving the economy and jobs, jobs, jobs. We will have lots of conversations about how to spur job growth in Indiana and how to maintain a climate that encourages job and economic growth. This is a budget writing year. Many of you know that odd years are the long sessions of the Indiana General Assembly. That means the session will start January 7th and it will run through the end of April. And the reason why it's a longer year is because the legislature is charged with writing the budget. The budget starts in the House, Ways and Means, and then will move to the Senate. What we know is that Governor-elect Pence ran on a campaigned about proposing a change to the income tax rate in Indiana, reducing it by 10%, and that's actually been met with sort of a mixed reaction in the State House, in that many of the long-term legislative leaders are concerned that they have passed a number of other tax cuts in prior years, including phasing out the inheritance tax or the estate tax and some other corporate tax changes, that there's a real concern that perhaps there might not be enough revenue to make up, to sustain the kind of services if we had an income tax cut. So that will probably be debated in a big way over the next several months. There are all kinds of questions about deductions and credits, and over the summer the Tax and Fiscal Committee actually studied a number of those credits, tax credits and tax deductions over the summer, and I'll show you a link to that website in just a moment. And then the other big issue for Indiana to consider are some of the federal budget cuts that are coming and how they will impact Indiana. What we understand from legislators is that, you know, they have stated pretty clearly that they don't intend to make up the difference for the federal cuts. So if particular programs in education or housing or workforce development are cut in their federal funds, I would not anticipate seeing a rush by Indiana legislators in the State House to make up for those cuts with Indiana tax dollars. So that we'll see a real change there, and that might create some shifting of priorities in Indiana. In the area of health care, of course, with the Supreme Court upholding the Affordable Care Act, there are all kinds of conversations and policy decisions about how to move forward. Governor-elect Pence has submitted the information back to the, through Governor Daniels, to the Federal Center for Medicare and Medicaid Services to say that Indiana will not create its own health insurance exchange. So what that means is that right now we are scheduled to either participate in the federal exchange once that's created, or possibly create some sort of hybrid, but likely at this point move to the federal exchange. Legislators have stated fairly clearly that they do not intend to have Medicaid expanded in the same way unless there's some way to use the Healthy Indiana Plan as that expansion vehicle. Although a new report came out just a few weeks ago that contradicted some prior reports about what the actual costs of Medicaid expansion will be. So we think those conversations around Medicaid expansion and continuation of the Healthy Indiana Plan will continue in a way that perhaps may be a little bit more open to finding a creative solution to increase coverage, because that's really the bottom line of this act, is to increase the number of people who have insurance, to decrease the number of uninsured individuals in our state, and what's the best mechanism for doing that. So there will be a lot of attention in the State House this session about health care and making sure that we meet all of the requirements and can respond appropriately to the needs of our state and to the new federal law. In the education area, we understand that the education reform agenda will be more of a tweaking around the edges from previously enacted reforms. There are some questions about, for example, how to deal with the takeover issues when there are school takeovers, what that grading system looks like, and is it the best method. There are always questions about testing and teacher evaluations and those kinds of things. So we'll see probably not as many or as bold of education reform bills coming out of the State House as we have in the past, but we will see some conversation absolutely about how to make those reforms better or more workable for local communities. The big conversation that's very important to us in the United Way world is the whole conversation about pre-kindergarten or pre-K or preschool. And we're very excited that there's bipartisan support for pre-K in Indiana, which raises some other questions because, as many of you know, there are long-standing efforts to improve early education entirely and to make sure that kindergarten, which is quite frankly not, many school districts would say it's not fully funded currently, it's not mandatory in Indiana, so there are some questions about how do we improve the entire early education spectrum from birth to 8 so that those children really are reading by 3rd grade, and that involves a number of strategies, not just pre-K, but making sure that child care is not only healthy and safe, but is really developing those brains in ways that those children will be ready for pre-K or for kindergarten. So we'll see a lot of conversation in that area. In the family and children's area, probably the biggest priority, again, a bipartisan effort, is really responding to the long study of the Department of Child Services. There were many criticisms of the centralized hotline, a lot of the staffing and staff processes and the training, and we will see a whole plethora of bills, maybe some big omnibus bills as well as some individual bills around reforming and improving services from the Department of Child Services. And we also understand that that will be a priority for the Pence administration as well. We'll see some other bills coming up, again, largely around that whole issue of, you know, what is the role of government in human services and who is deserving of those services. And one of those who is deserving questions involves a bill, for example, around randomized drug testing for TANF beneficiaries. TANF is the Temporary Assistance for Needy Families, commonly called welfare, formerly called AFDC. There was a bill last year, and it had broad support. It was amended along the way and ultimately died, largely because it costs way more to implement it than it would have saved, according to FSSA's their own studies. We understand that there's broad support for that, even though it costs, the costs are still far outweighing the benefits in terms of cost savings. So there will be some big conversation about those types of issues, about unemployment and who should get unemployment and at what level, and those kinds of questions. With this new area of bipartisanship, there's a question about to what degree the social issues will dominate the session, or will they simply be introduced and discussed and not necessarily a priority. We're not sure yet, but we know that there are a number of other issues that will come before the General Assembly. Some of those social issues around, for example, abortion or funding of contraceptives or those kinds of things. The marriage amendment is scheduled to be discussed again, and for those of you who don't know, that's the requirement to create an amendment to the Constitution is that 2 separately elected General Assemblies must pass the same bill. So the bill that passed in the last legislative session is up for consideration again this legislative session. There will be a great debate about that for same-sex marriage and other benefits that are similar. There were a number of criminal justice reforms. I apologize, I have a typo there, that might appear. You've seen some conversation in the media about medical marijuana or decriminalization of small amounts of marijuana, again looking at it from a cost-benefit analysis or from the health aspects. So we'll see some of those other kinds of conversations go on. There might be some conversation about immigration reform. So there are a number of bills that we would expect. On the left here you see some of the study committee recommendations, and these came out of the studies that were done this summer, and I'm going to flip over and just show you from the General Assembly website. If you're not familiar, I would highly recommend that you get familiar with this website. It's very convenient because you can sit at your desk and watch a committee hearing, send an email to your legislator, and influence policy directly like that. So over here on the left you see the interim study committees, and there were a number of study committees that met over the summer, and you can go through and actually pull up any of their committees and their recommendations. So for example, I'm showing you right now the Committee on Child Care. You see that they met a number of times. They actually had 5 meetings, and then they created a preliminary report, and that is reporting on what they found. And these PDs, or what are called preliminary draft bills, these are the bills that the committee came up with that were considered and then discussed and voted on. So generally speaking, a bill that comes out of a study committee that passes out of that study committee will be more likely to have some success of getting introduced and getting heard during the session. So you can see the Child Services Committee was a very active committee. Senator Holdman, who co-chaired it, described it as one of the most intense committees he's ever participated on. So you see there are a number of preliminary draft bills through that Child Services Committee and what their final report. With this particular committee, you can actually go back through and view the webcasts. They did archive the committee meetings, so if you wanted to see how those issues were discussed, how the child abuse reporting hotline was discussed, you can actually go back and view that. So coming out of the study committees are a number of recommendations. I'm going to flip back to our slides now. So we'll see a number of those recommendations advancing as bills, and certainly you can flip through and see some of the committee recommendations if you go to each individual committee. I've only listed a handful here. So let's talk about lastly, actually let me go back one more time and just reference the fact that we have talked a lot about what happens in the legislature, in the State House. We will have a new administration with Governor-elect Pence coming in, and he will appoint new individuals to lead those state agencies. And with a new administration and new agencies, we might see new policies coming out of the administrative side. There is a whole process called administrative rulemaking that occurs sometimes in response to a law that is passed. So the legislature will pass a bill, and then the agencies, the state agencies, will go through an administrative rulemaking process to determine how those bills will be made real or implemented. So that's one process. The other is that sometimes there are federal rules or federal guidelines that the state has to respond to. So for example, I'm going to use an example from child care. The federal government says that when you take Child Care Development Fund dollars, you have to have a plan. That plan has to be approved. That plan has to indicate how you're going to provide, for example, child care subsidies and who's eligible and what types of providers could be eligible to take those child care subsidies. That's through an administrative rulemaking process in addition to statute. So there's a whole process that is outside of the legislature that we also monitor as we look at how do we shape policy. So how can you stay informed and influence policy? Let's move right through that. So I first of all want to dispel any myth that nonprofits can't engage in public policy. You absolutely can. When we talk about advocacy or public policy, we talk about the full range of activities used to influence legislation, administrative rules, or policies. And that includes simple monitoring, and that's where we perhaps watch bills or subscribe to newsletters and we just keep an eye on what's going on. Sometimes we'll be involved in coalition work, and we encourage many of you to do that. From a United Way perspective, we are often involved in coalitions where we lend our name to those coalitions. Sometimes we will engage in education, where we will go out and help educate the community or educate policymakers about particular issues. Why is quality child care so important? What happens in a child's brain between birth to 5? We might educate about the importance of, for example, the Earned Income Tax Credit and how it helps lift families out of poverty. And that's part of an educational process. We might engage in some grassroots organizing, and that's where we're really trying to mobilize people to take action. Or we might actually do direct lobbying, and that is where you're actually contacting a legislator, a state agency, or the governor and saying, we'd like you to vote this way, or we'd like you to allocate money in a particular way. That's direct lobbying. Most of the other work that you do is education or advocacy. So United Way works in all of these areas. And our priorities, just in case you aren't familiar with the Indiana Association of United Ways or our United Way work, our policy priorities tend to mirror where we do work programmatically in the community. So a lot of our United Ways are involved in early education and in supporting families to help get their children through school. So we do a lot of work in education. We do a lot of work in helping families gain and retain financial stability. So we work with eligibility benefits and maintaining the Earned Income Tax Credit and individual development accounts and those things that can really help people move out of poverty and into independence, or as independent as they can be, because some people we know just are not able to be completely financially independent because of circumstances in their life or disability or something. We also work in health. We tend to play a little bit more supportive role in the health arena, again, with the goal of having more people covered by insurance, having access to quality health care, and engaging in fewer unhealthy or risky behaviors. And then lastly, we really work to strengthen communities. And the way we define that is that we believe fundamentally that a thriving community will have 3 thriving sectors. It will have a strong government program, a strong for-profit private sector where businesses thrive, and it will have a strong third sector, philanthropic sector, or nonprofit sector. And that's so in that vein, we are very supportive from the United Way perspective of things like the charitable giving deduction and charitable giving incentives like the Neighborhood Assistance Program tax credit in Indiana, which is going to be subject to review. It's always a question in the budget, and we will work very hard to protect that. Another part of our belief in strong communities and a strong, thriving nonprofit sector is a strong 211 network that helps connect people to community and faith-based organizations as well as government programs as they have needs. So we engage in all of these types of work, and we would encourage you to do the same. So I just received a question that is sort of related to our community strengthening area, and that is, the question is, in Congress, which party is most supportive of eliminating the charitable deduction? And quite frankly, that is sort of a moving target. The charitable deduction generally has had broad bipartisan support, and we understand that that's sort of a moving target right now. Again, both Democrats and Republicans alike have supported the charitable deduction because they know that community and faith-based organizations that rely on that charitable deduction are providing so much community impact for their local communities. The debate right now is actually about the cap on a charitable deduction, of how much charitable deduction should people be allowed to have. So in a prior version, there have been some questions of coming from, for example, President Obama even endorsed a policy that would have capped charitable deductions for the highest income givers. That is not something that was widely met with support even in his own party. So, you know, what I'm hearing from members of Congress and their staff is that there will likely be a preservation of the charitable deduction, but we need to make our voice heard in it and continue to have bipartisan support. So thank you for that question. I will continue to move forward, again, talking about our range of activities that we can engage in for advocacy. So let me just start off by saying nonprofits may advocate and lobby, and sometimes we try to make the distinction between education, advocacy, and lobbying. Education is where we're going out and we're telling people about the work we do, telling them about the impacts of certain policies, either positive or negative, or just what happens when certain policies are enacted. Advocacy is very much related to education. It's really telling that story. Again, lobbying is the direct contact of those policymakers, of trying to have them vote a particular way, support or oppose a particular position, or secure some type of funding. There are very strict rules about lobbying. Nonprofits are allowed to lobby, and we have a document that's posted on our website about nonprofit lobbying that has some direct links to the IRS and to the two state agencies that regulate nonprofit or regulate lobbying in Indiana, and we can share those. What I would encourage you to do is, if you are concerned that you are either lobbying a lot and it's time to start reporting, because basically the IRS says that if you do more than an insubstantial amount of business in lobbying of your total budget as a nonprofit, you have to act, you may be subject to additional restrictions. So nonprofits, because of that nature of being having a relationship with the federal government by being granted tax exemption and the ability to provide, for 501c3s at least, tax deductibility for individual donors, those nonprofits are limited in the amount of lobbying that they can do with their total budget. So it's all about how you spend your nonprofit resources. There are also some rules about what are the sources of those funds that come into your nonprofit. So for example, if you're receiving certain federal dollars or certain state dollars or certain federal or state contracts, you may be limited on the idea that any of those dollars could be used in the lobbying arena. So I encourage you to read your contracts very closely, know the rules. If you have a specific question, we convene nonprofit advocacy workshops where we spend a great deal of time talking about nonprofit lobbying. Again, I'll show you the link to our website where we have some materials posted already. You're welcome to download those, as well as some links to some other sites where you can get more detail. Lastly, I think the most important piece of that conversation about lobbying is to know that it's all about, the lobbying rules are all about the resources in your nonprofit, the cash resources. So since most nonprofits, almost all nonprofits, do not pay their board members and their volunteers, when a board member or a volunteer is lobbying for your organization for free, and they're not using any nonprofit resources to do that, that does not have to be tracked according to the lobbying law. So I really encourage you to have your board members and volunteers tell the story. Additionally, the volunteers and the board members offer a different perspective, because they can say, look, I give my free time to this organization because I believe in the work, and I think you should believe in the work too. You know, I give my donation, my charitable dollar to this organization, and this is why it's so important to me. I support children's services or youth mentoring or senior services or whatever the service is. Have your board members and volunteers tell those stories. So how do you get started? So we talked a little bit about learning the basics about advocacy and knowing those rules. What I really encourage you to do is take 5 minutes, take an hour with your staff or with your committee or with your team, and really think about the connection between the programs your nonprofit is operating and the public policies that affect the program that you're operating and the people that you are serving through your program, because there is a real connection between programs and public policies. And you know, from a United Way perspective, we think of it this way. We can continue to pour money and pour resources into certain programs to try to make a difference, and sometimes we could just continue to pour money into those programs, but without a policy change, we're not going to really have an impact. We need the program and the policy change in order to make the real impact with our investments and with our resources and with our volunteer time. So we encourage you to look at that connection between program and policy. Nonprofits that want to engage in advocacy may want to think about either developing, adopting, or approving a list of public policy priorities for your organization. You might want to think about, you know, there's a whole world of policy out there that you could engage in, but we advise nonprofits to really align it with your mission, align it with your priorities, because there's so much out there, and most nonprofits are just so busy that they don't have time to engage fully in public policy work, that they really need to narrow and prioritize policies that really align with their own mission and their own programs. So that should probably be approved by your nonprofit board of directors so that your board is completely aware and involved in that, and it's a way of helping advance those priorities as well by getting those nonprofit board members engaged. By doing so, you'll want to identify what are the key board members or committee volunteers who are willing to help me advocate for our services, for our clients, for our mission. So you might want to do, say, a relationship mapping exercise or survey your board members to find out who's willing to sign on to a letter to the editor or to write a guest column, or maybe who could be interviewed by the media, serve as your spokesperson for your organization. Because, again, sometimes having a volunteer do that really gives an advantage over having a staff member. Oh my gosh. You might ask them to attend meetings with you, you know, when you meet with legislators. So those are some of the things that you'll want to do as you think about how your board and committee members can help you advocate. So what can every nonprofit do, or what you should do to help influence policy. First of all, share your story. So many new legislators are not familiar with nonprofits. They don't necessarily know how nonprofits work, that you are driven by a volunteer-led board, that you rely on charitable contributions, the nature of those charitable contributions, and they don't know what you do or why. So I encourage all nonprofits to maintain a one-pager. Say what you do, what you need, what are the results of your work, whom do you serve, how many, summarize that as succinctly as possible. I tease sometimes with our in our advocacy workshops that many legislators, because they have so many things thrown at them, can really only handle about 3 bullet points on the back of that you can fit on the back of a business card. So try to be succinct in describing your organization and what you do, why it matters, what difference are you trying to make, and then a little bit about who you are and how they can learn more, because some legislators may be sparked with your information and they may want to know, how do I learn more about this? Secondly, we ask and suggest that people map their relationships, Kevin Bacon style. If you've ever heard the 6 degrees of separation with Kevin Bacon, and that's that notion that everybody knows someone who knows someone. So everyone, even if you don't feel like you know your legislators, if you don't have direct connections, you probably know someone who does. One of your board members went to school with someone who plays soccer, whose child plays soccer with a legislator, or was in a fraternity with someone, or goes to church, or has a cousin. There's some connection, and we encourage you to map your relationships, find out who is connected. We encourage you to educate your board members and your policymakers. So in order to educate your policymakers, you really need to start with your board. Encourage you to have conversations at your board level. Meet with legislators in your home district. Don't wait until the legislature starts in January and then try to come down to the State House when it's just crazy at the State House. Make sure you meet with them now and out of session. You can have newsletters, stats, stories, describe your policy impacts. One of the most powerful tools is an organizational tour if you have a facility where things happen in your facility, where you can have a legislator meet with clients or see your work, see your impact in action. We encourage nonprofits to promote and interact at every opportunity. You never know when you're going to be flying home from vacation and sitting next to newly elected Senator Donnelly, or you'll be in the line at a grocery store, at a sporting event, sitting next to someone who can really influence. And we encourage you to interact at those opportunities. And then there are a lot of advocacy coalitions. If your nonprofit is a little timid about engaging in this, or maybe you just don't have time or resources, know that there are other advocacy coalitions that you can join, both to get information about what's going on, as well as to participate and help shape those. So how can we work together? From Indiana Association of United Ways, we produce an e-newsletter that comes out every odd Friday. Today's an odd Friday, so there will be an issue later today. It's called the IUW Policy Update, and in that we talk a lot about some of our priorities in those education, income, health, and community strengthening areas, but we also talk about what's happening in Indiana as well. So we have some county-specific statistics that we include in there, sort of the updates of what's going on in the State House, direct links to some of those committee hearings as they're happening. So we encourage you to sign up for that. And in the follow-up that we will provide, we will give you an opportunity to sign up for that directly. We encourage you to attend what are called third house sessions, or sometimes called Cracker Barrel sessions, and they're actually called Cracker Barrel sessions because they're in the back room of the Cracker Barrel restaurant, and that's where the legislators go home, typically on a Thursday night, Friday, Saturday, or a Monday morning, and they meet with local constituents, and they hear the feedback. They provide what's sort of what's new in the State House this week, and then they listen to constituents. And I encourage all of you to go to those sessions and interact with your member, your legislator, and provide feedback from those local sessions. You can let us know how those sessions are going if you'd like. We encourage a two-way communication, so we send out a lot of information from our office. We welcome your feedback. So if a particular policy is seriously impacting nonprofits in your community, service providers in your community, we welcome that information back, and if we can't act on it, we probably know a coalition or another group that can. We encourage one of the other ways that we can work together is that, we're here in Indianapolis, and nothing speaks as well about local impacts as the stories from your local communities. So you can help give us stories, specific examples of policy impacts. When, for example, with the Healthy Indiana Plan, there were issues about implementation and how it works, with the prenatal care coordination cancellation of some reimbursement for that. There are specific impacts about families who were affected by that, young women who had to declare bankruptcy because of the lapse in their health care coverage. Having those specific examples really makes us better advocates for you in the State House. And then lastly, we encourage you to participate in, as you can, coalitions, and I have a whole alphabet soup of acronyms up here. ICHS stands for the Indiana Coalition for Human Services. It's a statewide coalition of human service programs. There's the Children's Coalition of Indiana, or CCI. They advocate for a lot of children's issues. The Coalition to Keep Indiana Warm is a coalition that works on utility assistance kinds of issues, and there are lots of other coalitions, so we encourage you to engage in those as well. I have just received another question, so let me just answer this question. Is the IUW a 501c4? And the answer is no, we are not a C4, we are a C3, and 501c3s can advocate ourselves. Just to clarify, 501c3s, nonprofits who are eligible to provide their donors a level of tax deductibility through the IRS, are able to lobby. It's a common myth that nonprofit 501c3s cannot lobby. They can. There are simply specific rules that you're not allowed to do it in a disproportionate amount to your budget. And so let me just bring that document up just to clarify. So the IAUW, public policy, if you go to our website, IUW, and then you click on, you scroll down from the front page, you can get to our public policy page. You see that we have a page there called Nonprofit Lobbying in Indiana, and this gives you a quick and dirty of what the rules are, what is the definition of lobbying, and what are the rules in Indiana, both for the, actually all three levels. At the IRS level, that's who talks about that sort of insubstantial amount of lobbying, and then the legislative lobbying rules and the executive lobbying rules, because if you try to, and I'll just be very clear here, I'll bring this up. So the rule, in essence, is if your organization spends more than $500 a year, that's of your staff time, so you would take, if I spend 10 hours a year lobbying, that's meeting directly with legislators, I would take 10 hours times my wages and benefits and other sort of indirect costs. If that costs more than $500 a year, I probably should register with the Indiana Lobbying Registration Commission and then report on my activity. We also have a rule in Indiana for executive branch lobbying that if my organization, my nonprofit, spends more than $1,000 a year, and it's not just nonprofits, by the way, it's anybody who spends more than that amount, more than $1,000 a year, would need trying to influence state agencies or the governor or the executive branch, they would have to register and report as an executive branch lobbyist. If you have more questions, don't hesitate to give me a call or an email. We offer a lot of support to nonprofits as they are trying to wrestle with, should I register or not, what is the rule, or what coalition should I get involved with. So we have another question about who do you send the stories to. So if you we had a question come up about this working together, this sort of two-way communication. Who should you send your client stories to? We sometimes collect them through a survey tool through our public policy update at Indiana Association of United Ways. So if you're on that newsletter update list, or if you've attended our advocacy workshops throughout the state, we will sometimes have a connection where we'll make those requests. If you are involved in a particular United Way or coalition, you may get that request through your local United Way or through that statewide or local coalition. So that's who you could send your stories to. If not, you're welcome to send them to me and I can forward them on appropriately. So let's see. I have a couple other questions that came up toward the end of this session, and that's about some of the resources. I know we flipped through a lot of websites, a lot of references to documents that we either have posted on our website or perhaps we've sent out through our newsletter in the past. We will send out a follow-up to this email with a lot of those resources. This last page of the slides gives you some of those helpful resources. Again, starting out with the legislative resources at the top from Congress. Then in the middle here we have the State House resources for the Indiana General Assembly, and then the two lobbying groups. The next three websites listed, CLIPI, Alliance for Justice, and Independent Sector, are three organizations that each have information about nonprofit issues, or specifically how nonprofits can engage in lobbying. They have some good tools and techniques, actually, some downloadable documents. And then the IRS.gov, of course, is the great resource. The Nonprofit Charity Division through the IRS has lots of resources on its website, although sometimes it's a challenge to navigate their website. And then lastly, the IUW.org, that's us, and we would encourage you to click on public policy and click on updates and register to get those updates from us. You can always hit delete. We don't get offended if you hit delete or if you unsubscribe if you decide that it's just too much email in your box every other week. So we encourage you to consider some of those. So again, and then lastly, actually, let me just slip back over there to the IUW website. So what I was talking to you before is the IUW website looks like this. This is our front page changes pretty frequently, and then you see here's the announcement of this webinar that you're attending today. If you go to newsletters and then click on policy update, you can see the archives of the previous issues. So some of those documents that I referenced are in the last few issues around the fiscal cliff, for example, and the impacts on Indiana. For example, that list of potential job cuts, although that was, again, last summer, so it's a little outdated. You can join our mailing list there on through that website. And then, again, the public policy piece is through we have a section dedicated to public policy, and during the session, we'll actually be listing a number of bill lists. We post a bill list that we maintain of the bills that we're tracking, as well as some of the key talking points for some of those high priority issues for us. And we'll be updating a number of these documents over the next month. So we welcome you to take advantage of those. Here is my contact information, and again, the other resource that I'll just call your attention to as a nonprofit, if you are not aware of the Indiana Nonprofit Resource Network, it is a wealth of information and training for really any kind of nonprofit, but our target market with the Nonprofit Resource Network are those small and mid-sized nonprofits who may not have huge training budgets. We have regions throughout the state where we try to hold trainings in communities near you, so you can see some of the upcoming training events are posted there. So we invite you to participate. Some of those have fees. Some of the fees are very small. Some are a little bit larger if it involves a national or out-of-state trainer that we have to pay expenses. So we thank you again for participating in this webinar. We do have an evaluation for you, and I'm going to ask my colleague to help me here with the evaluation because I believe we would like you to complete it while you are on the phone with us, if possible.
When you exit the webinar, the evaluation questions will come up automatically. We really want to hear your feedback and let us know what kinds of things that we can offer to help you in the future.
Great. So thank you, Lisa. So again, as you exit the webinar, you'll be invited to participate in a survey. I don't see any additional questions. I do invite you to email me questions directly. I am tied up in a couple meetings, but we'll try to get to them over the weekend or the early part of next week, unless it's a really quick question. Again, I welcome all of you to this crazy world of nonprofit advocacy. It is so important that we advocate for strong communities, and nonprofit organizations are such a component of strong communities that we really encourage you to share your message with policymakers, with neighbors, with anybody who will listen to know, why you have your organizational mission, why you do what you do, and how important that is, because that's how we educate each other about the good work that you all do. So thank you all for participating in this webinar, and we look forward to a long-standing relationship with you. So go forth and do good work. Thank you.
Thank you, Lucinda, and thanks for working with the Indiana Nonprofit Resource Network to bring you this webinar. And we've already gotten a few nice comments of thanks and praise for Lucinda's work, which is always very thorough and extremely practical and helpful. So have a great weekend, everybody.